Hi, Terrell Johnson here. Going to be going over the sheep heart. We will start with the pericardiums. This is your visceral pericardium, which is also called your epipericardium. There is a pericardial sac right over this, and then connected to that pericardial sac would be your parietal pericardium, and then the most outside layer of your pericardium would be your fibrous pericardium. I will try to keep the heart oriented so that this is the right side, this is the left side. We do have your apex and your base, along with your right atrium and your left atrium. The right atrium receives deoxygenated blood, and the left atrium receives oxygenated blood. We have your right auricle on the back here, and your left auricle right here. We do have your right ventricle and your left ventricle, as well as your interventricular sulcus. This one houses your anterior interventricular sulcus, and another interventricular sulcus that has your posterior interventricular artery. Anterior interventricular artery, posterior interventricular artery. We do have your pulmonary trunk, which takes deoxygenated blood to the lungs, as well as your aorta, which delivers oxygenated blood to the body. On here, this big part is your aorta. Coming off of this, or your ascending aorta, coming off of this would be the arch. The arch is missing, but we do have your brachiocephalic artery. Normally on the arch after that, you would have your left common artery, or left common carotid, and your left subclavian. Those have been cut off. For your veins, we do have your superior vena cava, which gets blood from the brachiocephalic vein, the coronary sinus, and your azygos vein as well. And this blood is going into your right atrium. And then we also have your inferior vena cava. Right, here's the inferior one. And that is also going into your right atrium. On the back here, we have your coronary sinus. And that blood is deoxygenated and also eventually going to the right atrium. Some of the internal stuff we have on here. We do have your pectinate muscles. Which would be the bridges on the wall of the atrium. So right about where the pointer is, that's about where they would be. You also have your myocardial walls, which is the myocardium. This side is your left one. And on this side, we have the right. The left is thicker because it has to pump pressure to the systemic body, which requires a lot more pressure than the pressure that is in your lungs for your right ventricle to pump blood through. On the left side, we also have your bicuspid, which is the valve that separates your left atrium from your right atrium. And on the right side, we have your tricuspid. These are also the cuffs, the flappy parts here. And this is your cusp. And you can see them better on this side. Cusp. The chordae tendineae is the cartilage that hangs off of the cusp, and those connect to your papillary muscles, which these muscles right down here. So it goes cusp, chordae tendineae, and papillary muscles. We also have the pulmonary semilunar valve, which if this is your pulmonary trunk, it goes through to the atrium, and dividing that is the pulmonary cusp. Or sorry, the pulmonary semilunar valve. Trying to get a view of it. Right there. And then on this side, you would have your aortic semilunar valve, but it is pretty deep. But if I stick my probe in from the aorta into the ventricle, it does have to cross through your aortic semilunar valve. That is everything. Thanks for your time. A couple additions. Your auricles do allow for extra capacity for your atrium. When the body needs it, these will expand to allow extra blood flow into the atrium, normally during times of exercises. And also, we have your trabeculae carneae, which are the ridges in the ventricles. Right down inside here. All these little ridges. Thank you for your time. It's been a pleasure.